Alright, what we're going to demonstrate today is CPM setup, in and out with the patient.
All right.
Alright?
Okay. Lauren, are you going to...
Basically, I'm going to explain to Lauren
Okay.
how to put this on and take it out of the
All right.
patient. So
And BJ, what do we use this for?
this is basically what we use for post-op day one for total hip or total knee arthroplasty.
Okay.
Sometimes we also use it for post-op day one arthroscopic knee surgeries.
Okay.
It depends on what the doctor will put in.
All right.
All right. So Lauren, what we're gonna do is we're gonna just place the CPM onto the patient. So you might want to stand right here.
Okay.
Support that thing. Turn that knob counterclockwise to unlock.
So we're going to turn this way.
Counterclockwise. And then take the CPM down.
All right.
Okay. Now basically, you're gonna have to lock this CPM into this position. By doing that, you're gonna do that by pressing this one down, watching for the patient's leg. Make sure it's not these paddles are not gonna hit the patient's leg. So you're gonna push it down until this thing snaps back down into place.
Okay. So the little knob is
Right. So
Even.
it needs to
Depressed.
snap. Yep.
depressed.
And
Now
you can
it's-
feel it's not moving now.
All right. And PT would come in, correct, and do the first?
Absolutely. On initial evaluation, we will set everything up. We will set the axis to be aligned on the knee and the hip. So basically, what a nurse would do is, if the nurse needs to put it on, the first thing she's going to look at is the hip axis right here. It's like a little plus sign over here, and it will have to correspond to the greater trochanter of the femur.
Okay.
That will be the bony prominence right on the lateral aspect of the upper thigh.
Okay.
So at this time, if the patient has an overhead trapeze, she can use that to kind of slide down until you get that greater trochanteric area right there.
In alignment, correct.
Right. Now, if you got that in, as I said, the PT has already adjusted the knee. It should already be on the knee axis. If not, there's a way to kind of adjust the knee axis by way of twisting this counterclockwise, pushing it down, then lifting the thigh bar up as far as you can, and just release everything
All right.
right there.
And does the doctor give you the degree of access that he wants, or is it pretty standard?
Not really. On our initial evaluation, we will try and measure the patient's knee, how much the patient can tolerate,
Okay.
and based from that, we can, like for example, on sitting position, we will bend the knee. If it can bend more, around 50 degrees, then we're going to put the CPM on 55-degree setting.
Okay.
If not, if it's full of bandage and stuff, and basically can't measure it accurately, we will start it at 45 degrees.
Okay.
All right. Now you got it to its longest position. Now you're gonna turn this thing on. This is the settings box. So you're gonna have the settings there for flexion and extension.
Okay.
So you always want to put the extension on 0, and this will vary.
You'll put it about 50.
We'll put it on 45. At
45?
this time.
Okay.
And this is the speed.
Uh-huh.
5 is the fastest, and 1 is the slowest.
All right.
And that's important for the nurse to know, because a lot of times the patient will say, this is flexing too much, and we can call physical therapy, and they may say, okay, just lower the amount that the knee is flexing. And so then we just use that box and change the flexion a little bit.
Okay. Mm-hmm.
Okay. So I'm gonna ask Lauren to turn it on.
So you're changing this box for the speed, correct? Or
Right.
up
Or
here?
the degree of flexion.
flexion. Okay.
But we always ask PT first if it's okay.
All righty.
Okay. Also to note, there's a on and off button here,
Okay.
right underneath here.
All
So when you turn it on and it's not responding, you might want
Make
to
sure.
check on that first.
Yes, that's great.
So go ahead and turn it on.
Is it going?
Give it a minute. Oh,
Okay.
you know what? I unplugged it already. So.
Oh, okay. Okay. It's important to always have your equipment plugged in.
Yeah.
That's true. It's a good lesson.
Okay, so I'll try to turn it on again. There it goes.
Okay.
Okay.
Okay, we want me
Okay, that's fine. Now it's important to film this one. You're gonna wait until it fully extends down.
Okay.
And once it's in its full extension,
I'll call you right back.
you turn it off. It's also important to note that the patient does have a switch on and off button that is right beside him or tied on the bed rail.
Okay.
At this time we don't have it, so you can use that to kind of adjust the knee because you don't want to do this at the same time bending forward
Correct.
and doing this. So you can just put that on your right arm.
Uh-huh.
Now the way to adjust this knee axis is you push this down, the knee axis part,
Uh-huh.
and the knob right here. So go ahead, Lauren. Just this one.
Okay.
Excuse me, sorry.
Uh-huh.
And you turn the machine. Once you turn it in, this is gonna move. Now I'm gonna stop it for a moment to kind of find out where the knee axis is. So most of the time the knee will be wrapped in real thick bandages, so you won't be able to locate the lateral epicondyle of the femur, which is the knee axis.
Uh-huh.
So what I usually do is I'm just gonna slightly flex the knee and find out where it is. It's
Okay.
gonna be right there, and I will put some sort of a marker like a pen right here, kind of mark where the axis is.
Okay.
All right?
Got it. Mm-hmm.
Now once you got it, you're gonna turn the machine again, and it'll telescope up to that axis.
So it's moving.
It's gonna move. Yep.
Mm-hmm. Where Lauren's left hand is, it's moving towards her, and it's now moved towards the pen where the axis.
Right.
Now
It's
we're lined up
located.
with the knee.
Now we're lined
Uh-huh,
up.
great.
You're gonna lock that thing.
I just screwed that.
Screw it in. And you got it. The next thing you're gonna do is you're gonna put the slings on. So what I usually do is put the leg sling or the calf sling on, and it should correspond to the bulk of the calf.
And you're a little bit more gentle with the patient that just had knee surgery.
Yeah.
Yes.
Is that okay?
Now, when you clip that thing into the pegs, make sure there's a 1 to 2 finger breadth space between the pedal and the
Correct.
strand.
That's very important. Mm-hmm. Very important. Very good. And she's now doing it up to the upper leg.
Yep, and to the thigh, right
I need more. Oh, sorry.
And what did you do? You,
Locks in place.
you snapped it up there?
here.
Mm-hmm.
Yep, snap it
Okay.
into the peg. Now, you can also loosen it up by
Uh-huh.
unstrapping it and just
Got it.
1 to 2 finger breaths, and we got it right there.
Now
we
we're
usu-
going to put the foot pedal on.
Gonna put the off note also. This one, you can basically move this one up and down, or towards the head, or towards the foot of the foot
Uh-huh.
by unscrewing this.
Alrighty. Okay.
So once it's in position, put on the foot
Do you
component.
put the foot in first?
Yeah. No. We right here.
Okay.
Unscrew this right on the bottom. This is a different knob from any
Oh,
other
okay.
knobs here because it's a lefty tighty.
That goes in. Screw that in place.
Right?
And then put the foot in.
Make sure that the foot will be flat on that foot plate. There you go. And strap it in. And then put
Great.
the person strap. And then lock it down here.
And that's
Going
left,
to the left.
not righty-tighty.
Righty tighty.
Right.
Okay.
Now you're ready to start it on.
So let's see a cycle what happens here.
And you should always watch a couple complete cycles.
Right.
Physical therapy usually does this for you, but you know, a couple cycles will go, and sometimes the patients call you back because it's starting to bother them. So it's important to make sure they have their call bell in reach before you leave.
Mm-hmm.
So that's 45 degrees right there.
Mm-hmm.
Now it's going to slowly extend.
How's it feel?
Good.
Good.
Very comfortable.
Is it comfortable?
It is, but I don't have any knee pain.
And how often does the patient have this exercise? Is it usually for 4 hours, 1 hour, 2 hours at a time for the
Usually
first?
we do 2 to 3 hours in the morning, and then a break at mealtime and lunch, and then 2 to 3 hours in the afternoon. So
Okay.
a total of 4 to 6 hours the whole day.
That's our goal.
What's your goal? Yes. And do they eat while they're in this apparatus?
No, we usually take them off of it during mealtime.
All right. Thank you very, very much.
Okay. You want me to show you how to take it off? Or
Sure.
it's okay?
Yeah, just take it off.
Okay, wait until it fully extends. I'm going to turn it off right here.
Okay.
Okay, now first thing you're going to take off is the foot component.
Okay.
You're going to unscrew this and strap this thing.
Actually, nursing students may be doing this to
And
help the
strap
nurse.
this thing,
Absolutely.
and then take the whole thing off,
PCTs can do this as well.
and then stow this into a cabinet or a drawer.
All right. Don't throw it away.
Yeah, don't throw it away. And snap it. This thing and snap. Same thing with this one. Then you're ready to take the CPM up. You can do that by slightly pressing down on this thing here, and then turning this counterclockwise again.
Knob comes out.
And it will come up, and wait until this one snaps back in, and then it's locked. Now, together with these straps, you will see this one. This is another strap to kind of secure the CPM into the bed.
That's a good idea.
Right there. So just after that, you kind of gently lift the patient's leg, take these off, and strap them back into the CPM, or clip them back in. So it's that you're not going to lose them. That's it.
Great. Thank you so much.
Welcome.
Appreciate it. Thank you. Thank you, all of you.